whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Vollrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward. Today we are talking to Raymond Rupert, the CEO of RCM Health and the founder of Healtheon. Previously, Raymond was a practicing family physician and has since branched out into the innovation and technology department, applying his background in healthcare now to bringing more advances towards the system and helping us move the actual system into the future. Dr. Rupert, thank you for joining us. I understand you've dropped the doctor prefix lately and you really dived into the health technology side of things. Thanks for taking the time to chat this afternoon.
Thanks, Jordan. Yeah, I want to be the friend to everybody, so I don't want to distance myself with the prefix doctor. So I'm just Raymond, just good old Raymond who likes to help people.
We'll go with Raymond. So give us a little bit more about your background. You know, when you were identifying as a physician, what was sort of your niche? What did you actually do for your practice?
Yeah, so I was your general purpose general practitioner, everything. Otitis media right up to stitches and everything, including deliveries. But I eventually went off to business school and got an MBA at the Rotman School. And after you get an MBA, you think you know something about business. So I started one. And I started RCM Health 30 years ago. And I chose to focus on complexity, sort of helping the most complex patients. Because our healthcare system is siloed, here's cardiology, here's neurology, etc. When you have somebody complex with multi-system involvement, the system does not help in all cases. So we created a system and an ecosystem with about 4,000 specialists, all these smart people, and they work on teams. And then we get advice, so you don't have to travel to Boston or Baltimore or Montreal or anywhere. And we get the advice. Our job is to help patients access the services in Canada. Okay, so that's kind of what we've done for 30 years. And we like helping patients.
And you guys were one of the pioneers in terms of virtual care and telehealth. What was that like, being one of the first people to start adopting the phone and the internet and applying it towards healthcare?
Yeah, well, we used to have a dial-up modem. You probably weren't even born then.
So, I get PTSD flashbacks listening to my mom yell at me because the modem was jammed up, me playing video games, and she couldn't take calls.
We've had 30 years using virtual care. So we have one of our medical case managers lives and works in Provence. Got staff in Montreal, Vancouver. So we're all over the place. And we can service folks in rural Newfoundland or northern BC. So we can take care of people everywhere. I'm not taking anyone's blood pressure because they already got, 5 or 10 doctors. So we are using sort of research and the knowledge of our ecosystem and specialists to help.
And so what was that first problem that you solved, I guess? How did you actually go about connecting patients with the available services in Canada? How did you actually untangle that mess?
Well, the first case I ever did was actually my daughter. So Farah was 18 months old, and she was in sick kids with sepsis, and she was dying, essentially. And so all the docs there were scratching their head, and no one knew what to do. So this is a long time ago. So anyways, there was a new machine in town called the ultrasound machine. So I called the doc at Mount Sinai, who had one, and said, would you mind doing an abdominal ultrasound on my daughter? So they wheeled her over from sick kids to Mount Sinai. They did the ultrasound, and he called me to say she's got a ruptured appendix. So it was only because I became, an advocate and challenged the state of ignorance in her case And I learned that everyone needs an advocate. And so 30 years later, we're doing that every day.
How big has RCM grown to over those decades?
Well, we're a tight shop. We've got about 30 employees, 4,000 specialists, and about 3,000 suppliers. So it's an ecosystem designed
No doubt.
as complexity.
And then is that what led into founding Healtheon, applying the technology that you needed to create internally?
Exactly. So over the last 40 years, I've watched the erosion in primary care. And I said, I've taken a small family practice and turned it into, something that really helps people. So why can't I take those learnings and apply them to any family doctor or nurse NP-led clinic in Canada? So after 2 years of scratching my head and creative thinking and planning, we have a model that really works. And so we're just launching it and rolling it out now. And we're going to be able to help not thousands of patients, but millions by scaling this network.
And so when it comes to the Healtheon model, is it more of the software and the tools and the patient engagement, the booking, like the messaging, or is it more of like a clinic revitalization, almost like a consulting project and then revamping the business operations, or a hybrid there?
Okay, so when you talk to the healthcare leaders, they talk about two patient journeys. They talk about the care journey, but there's also the administrative journey. So we're focused on making the administrative journey as seamless as possible. So we have an AI-enabled technology stack or platform that is very smart. And patients can interact with an AI chatbot. They can book their own appointments. Senior citizens that don't want to type can create verbal tickets. They can talk to the system and create tickets. You can do your own ticket if you need a chest X-ray. And all this is funneled into admin in the office, so you don't have to phone them 10 times to book an appointment. So we're making the administrative journey much easier for the patient. Okay, that's the first pillar. So we're also adding a lot of administrative efficiencies. So the patient has an enhanced admin service. Okay, and then we're adding my favorite part, which I think is the secret sauce, is team-based care. So every doc wants an NP, if they can afford one or find one, an RN, a PA, an IMG, a researcher, a social worker, etc., as part of a team. And that is a wonderful place to work for everyone. And it's a great place for patients.
And how does the patient interface with this? I'm assuming there's a digital portal or an app, or is it phone-based?
Exactly. So once a patient activates inside Healtheon, they have a patient portal with all the tools and widgets, and they're empowered. So we're empowering the patient.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today.
And all of a sudden, they're partnering with their doctor. And that changes the world. Because, the tech in primary care that's customer-facing hasn't changed in 40 years. So there's a lot of great tools and AI that we can bring to the primary care practice.
How did you guys actually navigate that team-based care? Where do the responsibilities cut off for one person and start for another? How do you actually handle that handover?
So that's actually interesting. So I take it you haven't worked in a team.
I've been on a team or two, but not in this context. As
No, I'm
not a
not talking
functioning
about,
one
I'm not talking
particularly.
about badminton or pickleball. I'm talking about, so at RCM Health, we work on teams. So we've got a doc leading, we got an NP, an RN, a PA, an IMG. They work on a team, and everybody has, like there's a quarterback, there's a halfback, there's a center. Like everybody has a role, and it's all coordinated. And then we have a tech platform that helps them to work together. Okay, that is the secret sauce.
And so, how does the tech actually handle that? Is it like the sharing of notes? Is it communication between the providers? How do you actually foster that? Because this team-based care model is seemingly the way of the future here.
All of the above. So what we're going to do is sign your clinic up with Healtheon, and you'll get to experience it firsthand. So it works beautifully. Yep.
And is it launched already, or is this a pre-release product in beta?
No, we're just starting to roll. We got 5 docs on the way in. We're pitching a lovely nurse practice, an NP-led practice with 5 NPs that don't have a doctor. So we're just starting to roll. We got about 10 people on the team working on it, and it's very exciting to be able to really improve primary care.
And so walk me through the patient journey. Let's say they come in for routine family practice type stuff. There's no crazy specialty required yet. How do they actually interact with the platform?
Well, say you want an appointment. If you enrolled in Healtheon as a patient, you get access to a calendar.
Yep.
Okay, so you say, oh, well, I'd like to come in on Wednesday morning at 9:30. It's open. So you book your own appointment. And then you want to sort of advise the nurses or the doctors that you need a renewal on some meds and you need a chest x-ray. So you create a ticket, and the ticket goes to the office, and now they know what Dr. Jordan needs when he comes into the office. Okay, so there's communication. Then if you want to know what the hours are at the clinic, you talk to the chatbot that knows everything about the practice. So now you've confirmed this and that. You've got a ability to create a ticket, to create your own appointment, to show up, and it's all there in the administrative system provided by Healtheon.
And so the digital patient appointment bookings totally makes sense. When you get to the next side of things, like the requesting labs and imaging, how do you handle that side then in terms of who's ordering it, who's responsible for the review and the results?
Well, you've got a doc. Hopefully you've got an NP. You like NPs. You've got a physician assistant. We may have a clinical assistant as an IMG. So various people team, a PA can prepare the rec, but the doc or the NP has to sign it. So all of that is orchestrated.
Gotcha. Okay. So you get like a brief synopsis of everything that's been going on, perhaps request a patient visit before sending out the x-ray. Perhaps you say, get the x-ray and then we'll have the visit, but streamlining everything.
That's right. You can even have a virtual consult if that's, something in the scope of services of the clinic, etc. Sure. And
then let's say the patient's feeling depressed and they want to speak with the behavioral health consultant as part of the practice. How does that then interface and work in with the physician's workflow?
Yeah, so a number of teams have social workers or registered psychotherapists. And so the person might get triaged by the doctor, but then go downstream to the social worker or the registered psychotherapist, who is attached to the practice. So we've got an expanded team. And now you got to ask me, how does all this get funded?
How does it all get funded? That's the crux of everything.
Well, we sort of learned from Netflix. Netflix uses monthly subscriptions. So in our model, the patient, if they choose to be part of this, is paying for what are called uninsured services. So their block fee's been around for 20 odd years. So they're paying for use of the tech, enhanced administration, and nurse and social worker services, etc. They are not paying for the doctor's time because you can't do that. So we then have a subscription engine, and the doctor can charge whatever is appropriate, $20 a month or $30 a month.
Yep.
And once the patient is activated in the system, they get access to everything.
Okay, very cool.
Yeah.
And then here in Alberta specifically, the big critique of the team-based care model is the sort of, how does the doctor wind up getting remunerated then to be managing some of these other interactions? Let's say the PA's ordered a chest x-ray and the doctor needs to review it, or, patient comes in with the automated chat bot, needs a refill.
That's actually very interesting. So there's the government of Canada and every province knows that there's a capacity issue in primary care, right?
Yep.
Would you agree?
Oh, 100%.
Okay. And how many millions of patients in Canada don't have a primary care provider? You want to guess?
Like a third of them, I think I've heard.
Well, at least 6 million. Okay. So what we are doing with team-based care is we're actually expanding capacity in primary care. But once you add an NP, RN, PA, IMG, whatever, you can double the capacity. Okay? So now a doc's got 1,200, they can move to 2,000 patients easily.
Yep.
Okay? And there are compensatory billing issues because you're now billing for 2,000 patients. And the NP is spending 30 minutes and you're spending 5. So there's tremendous efficiency in the use of the primary care provider's time. So part of the key to this whole system is the ability to service orphan patients, which is profound. I'm hoping I get my Order of Canada for doing this someday.
Absolutely.
I know you're going to send my name into the Order of Canada committee for expanding.
We'll be submitting it after we hang up here.
Absolutely. Because we're expanding primary care capacity and we will be able to help millions of patients.
Tell me more about how the platform actually fosters that collaboration between the team members. What's different between the EMRs that we've been currently using and creating a task or a message? How do you actually build that team dynamic more efficiently?
Okay, so EMRs, you need an EMR. It's a place where you hang documents. But the creation of tasks and the assignment of tasks is the key to team-based care. And so we're able to do that. So that this task goes to the NP, this task goes to the doctor, this task goes to the PA, etc. So it's the assignment of tasks, which is more like the management of a project, as opposed to looking through an EMR to find a chest x-ray report.
Gotcha. So it's more the structure of how the software is actually organizing around the patient unit then. It's more of a project management tool as opposed to like a document storage solution.
If you want to sound really learned in this field, we talk about a patient-centric approach.
That's a big buzzword lately as well. Absolutely. Try and incorporate that as much as possible.
Join the conversation, talk about patient-centric care, which is what we're doing.
Very cool. Very cool. And when are you guys actually launching here in Alberta?
Oh, we're already launched. Yeah. We've got one clinic there starting up.
Oh, fantastic. Okay, awesome.
And some docs are really interesting. They're starting up specialty programs.
How so?
Well, there are docs that are starting up longevity and wellness practices.
Yeah.
And they're bolting on a whole series of different disciplines to help patients manage toxic stress so they don't stroke early. They might talk to the holistic nutritionist. They might talk to a fitness person. They might get their metabolic testing done. So what's evolving are really specialty programs coming out of primary care. And docs are really interested because they can go deeper into their specific interest or discipline. Another area is called concierge care or prevention. And patients are actually interested in these types of approaches. And it's working well. It's much more customer-centric, patient-centric, and provides a good experience and better health outcomes. You're not munching on donuts all day.
That goes a long way.
Exactly. That's right. And maybe, hiking in Banff or something.
And so, how has this system evolved over the decades that you've been involved in healthcare? Are we looking at the same problems today that we were looking at 50 years ago? Or what was it that sort of created the impetus of diving into the solutions side of systems level problems for you?
Yeah, so when we talk to docs, very bright, motivated individuals who are burning out. They're not happy with the administrative burden. Their office overheads are expanding exponentially. Some of them are having to reduce their income to fund the operating expenses. So docs really are not paid adequately for their responsibility. So that's only part of it. But then we started looking at patient outcomes. So if you have to wait 3 weeks because you've got an abdominal pain because you got a pancreatic cancer, it's not really a good thing.
No, of course not.
So we've noticed, not documented, but noticed that there's been some erosion of service levels. So that was the impetus. And if I'm going to get my order of Canada, I've got to fix it.
Absolutely. Well, and was access to care the same amount of a challenge for patients back then as it is now? Was it different meaningfully in your eyes, or same boat?
It seemed to work. The docs were workhorses. There's a new culture now with the next generation. So the docs were workhorses, and they just kept plodding along. But when you look at how healthcare sort of started in Ontario, like way back in the 30s, the way that healthcare operated was that a group of farmers got together, and the group of farmers and their families hired the docs. And it was almost like a little cooperative or collective.
Yeah.
Where the patients were partnering with the doctors, and it was a very tight relationship. And we're hoping to reintroduce that idea of a collective to the practice. Everybody in the practice is part of a collective. And hopefully they see if they contribute to it, it gets better for everybody. And that's important.
Well, the more we can work together, distribute those patient care duties more efficiently, the better.
Absolutely. And when we roll it into your practice, you're going to be very happy.
I can't wait.
Absolutely. We're signing you.
And so patient care access has changed over the years, perhaps for the worse. What about the admin burden side of things? You've been around for the transition to things being digital. Yeah. Have things improved from that perspective, from paper charts, or is it still a bigger problem than ever?
Yeah, the administrative burden for docs has increased. Unpaid administrative burden. So that's not really good. What you want with team-based care is being able to move some of those documents, some of that administrative load off to the team. And the doc can review a document in 30 seconds and sign. But they're not spending 1 or 2 hours a day on administrivia. And it's working better.
Just dealing with unpaid tasks in the EMR, results in the inbox, reviewing imaging.
You got it. That's right.
And how do you see that ideally getting delegated now then?
Well, you can't. You don't have a team. You're missing dinner with your family. Or you're not going golfing with your buddies on Wednesday afternoon because you got to look through the EMR or charts or something else. So we want doctors to have a better lifestyle. We want patients to have a better experience. And all they have to do is spell Healtheon.
And what does the ideal team look like? Who are the constituents on that cooperative team model?
Well, if we look at RCM, we have different teams. So we have a doctor who leads. We have support through an NP. We have IMGs as clinical assistants, an international medical grad. These can be very bright people. They're just not licensed. So they're not signing a script.
Yeah.
But they can review the records and do a clinical summary or something. And then we've got administrative backup. So that's a team. And we have 5 of those teams. So my job at RCM is to conduct the orchestra, which I enjoy.
And have you tried testing that model over the years of size and constituency? And it's that core, what would that be, like 3 people, 5 people on a team? What would be the absolute minimum
That's a
then?
good starting point. Yeah, let's assume there's 3 to 5 supporting the doc.
Yeah.
But then as you get better at this, you can expand the team to include a social worker. There's a lot of unmet need for social workers. You could add physio. You could add a whole series of folks to your sort of team, and we have a billing platform that allows to bill for things that are not covered by the ministry.
And what's been the reception of that on the patient side of things? The physician and the uninsured services versus like the completely uninsured staff members, right? Like your physio or your psychologist or your dietitian. Does that wind up getting covered by the patient's subscription model? Is that robust enough to actually allow for all these ancillary services?
It's covered by the subscription model. That's right.
Okay, fantastic.
Yeah.
And how many patients do you need to have on your panel in order to facilitate these different levels of support?
Well, an average doc who's somewhat busy has got, 1,200, 1,500 patients. The very busy docs have got about 2,000.
Yeah.
So if they start to sign, say, 200 patients in a subscription model, and that grows, say, 10% a year,
Yep.
by year 3, you're sailing. Like you're very happy.
Yeah.
You've got the revenue. So today I spoke to a nurse practitioner-led clinic.
Yep.
5 NPs. No doctor. So their budget's covered by the ministry. And so they have 2 buckets. One is called operations, that bucket, and then they have salaries. The operations budget hasn't increased in 14 years. So the NPs are having to take their salary and apply it to the operations of the clinic. I think that's fair.
I don't know. It's like how it works in medicine. Is that fair? It's a good question.
Well, all they have to do is put Healtheon in place and give patients the option of becoming a partner.
Yeah.
Running a practice as a collective. And everybody helps. That's the philosophy.
Has there been any pushback from the patient side of things on running the model this way?
Well, it's optional. Like the patient doesn't have to opt in.
Gotcha. Okay.
Yeah, they can opt in or not opt in. If they want sort of, enhanced admin services and technical facilitation and team-based care, they just opt in. And if not, they can stay out.
And then is there any financial downside to implementing AI and tech into your practice from this angle? Like, does it wind up saving the clinic money overall?
Absolutely. Yeah. Well, try to call the clinic to book an appointment. How many times do you have to call?
Yeah.
And is there voicemail? Maybe not, or it's full. And is there email? No, there is no email. Okay, well, we just have a lot of unhappy people. So
what kind of
yeah.
When it comes to actually implementing that team-based model like that, what kind of training or what kind of things do the physician quarterbacks need to keep in mind to actually successfully launch this type of a practice?
Yeah, we have a consulting team that helps the docs figure out how to work in a team.
Gotcha. Okay. And what does that process look like?
Well, we have a sort of a course 101 on team-based care. So we deliver these as webinars or lunch and learns. And so it's a mini MBA program on how to collaborate, how to work a project, what the tasks are, et cetera, et cetera. So that's all available at no cost.
And so I got to ask, what are like the highlights of the 101 team-based care course then? Like having worked in practices, I don't know if I would necessarily describe them as like a team-based care practice. It's more like you got lone wolves all over the place of different disciplines,
that is
kind of
actually,
independently operating.
well, that may be a flaw in the medical education, because when I went to medical school, they didn't teach me about team-based care. But when I went to my MBA program, the first thing they did was put me on a team. So there's something missing at the medical school level. So we teach it. And clinics that sign up for Healtheon have available resources to help them figure it out.
And so how do you even begin doing that then? How do you direct your patients of how to access the service, how to get started, who to interact with? Like, how does that even kick off?
Yeah, Healtheon has an entire onboarding process for patients with
Yep.
videos, emails, and newsletters. It's all there.
Yep.
All the clinic has to say is, we'd like to talk to Healtheon, and it's all there.
And then what about for the smaller teams? Let's say you're just getting started. You want to start growing your practice. How do you get going with, let's say, 2 providers, easing into that team-based care model as opposed to the full revamp?
Yeah, they don't have to go, and hire, all kinds of folks. They can start with a part-time nurse or a part-time PA or a part-time NP, because they'll have a budget for it from subscriptions. So it isn't like you're going to, go to the bank, take out a loan, and hire 5 people. It's not going to happen.
Yeah, completely page 1 rewrite for the whole clinic.
Yeah, so the idea here is to start incrementally. You get a part-time RN. All of a sudden, that seems to work. And then you hire a part-time or full-time PA.
Yeah.
And off it goes.
And when it comes to working with the PAs or the RNs or having an IMG, what have you found in your experience, are the different nuances between these specialties and how to most effectively use them within that team-based care model?
Well, they all have their scope of services, and their competencies. So you as the leader of the team have to figure out who's good at what. Who's got certain language skills, who's more empathetic, and you have to be able to manage their level of competence. So.
And does it depend more, as you build your team on the patient demographics? Is it more of like the special interests of the physician quarterback in terms of assembling the team? What are the things to consider before you even get going?
Yeah, all of that factors in. Like if a doc wants to run a wellness clinic,
yeah.
Maybe they've had a wellness program personally for years and they want to be able to, kind of build on it. So they build a prevention wellness program. There's a subscription plan to pay for it, and off you go. The other thing we're going to be putting into Healtheon is the ability to get a virtual specialist consultation done within, say, 2 weeks.
Very cool. How does that operate?
Well, if the patient chooses to buy a plan, it includes the virtual second opinion provided by RCM. And if they have some medical condition, heart attack, stroke, or cancer or something, then we work with the primary care provider to get the data. And we've got 4,000 specialists that provide a virtual consult within 2 weeks. Hopefully, if people are interested, they'll dial into healtheon.ca. And Healtheon is spelled healtheon.ca. We got lots of nice people to respond, and we'd be happy to sign up primary care or NP-led clinics anywhere in Canada.
Amazing. Well, Raymond, thank you so much for taking the time this afternoon. Appreciate you sharing your insights in terms of the system and sort of how to bring that experience and wisdom to the technology field. And looking forward to seeing Healthy out in the wild.
Thank you very much, Joe. Appreciate it.